So the 5 coping mechanisms of men: anger, addiction, sex, silence, and sports. Let's talk about them. Today we talk about addiction. Addiction is a very difficult thing because I always say that the drug of choice, whether it be alcohol, food, porn, heroin, cat, marijuana, whatever the case may be, is a tablet that you take to make a pain disappear. So what is that thing that you're not dealing with? And quite often we keep going through the same old. We keep going to recovery centers that deal with things in one way. We keep going to support groups that deal with things in one way. And we've unfortunately gotten locked into this 12-step program thing that isn't really working. I don't feel it's working anyway. I'm not a product of a 12-step program, and I've worked in them, and I've chaired 12-step programs. The problem is they don't deal with the root cause of the addiction. And that is the thing we need to get to. What is the root cause of the addiction? Is it childhood trauma? Is it bad relationships? Is it a narcissistic parent? Is it... it's endless, but we need to get to the bottom of it. Why are you taking this medication to numb the pain or the voices in your head? That's what we need to find. And once we find that, then your addiction, not only your addiction will leave, but the desire to use will also leave. And that's a more important thing. I always say I have a sobriety date, which is 17 years now, but then I have the day, which is about 2 years later, where the desire to use left me. And that was the best, most freeing day of my life when I discovered why I was using alcohol and what pains I was trying to cover. So what we do in our program is we come to people and we say, well, you have a problem. You are not the problem. You have a problem, and that problem is called addiction. So what do we do about that problem? Well, let's interrogate the problem. Let's see where it comes from. When did it first come into your life? How did it start? What is it that triggered it? And we ask a bunch of questions, and hopefully finally we get to a place where we learn the reason why you started using it in the first place. And this is where we need to get to in order to help heal addiction. And I don't like the fact that I have to stand up every week and go, hi, my name's so-and-so, and I'm an addict. No, I'm not. I am a recovered alcoholic, or I'm a recovered addict, right? It's not a label that I'm going to brand myself with the rest of my life. And I've seen people that have been going to this rooms and things like that. No, I don't slate it. It works for some people, but it works for a very few. I don't slate it, but I'm not going to stand in a room every week and declare that I'm a mess up. I'm bigger than that. I'm better than that. And I need hope. I need a future without this thing called addiction in my life. If you want some guidance in terms of addiction, give us a call.